While we often worry about cleaning supplies and tools as hazards in our homes, it turns out some of the most dangerous items might actually be in your medicine cabinet. Despite being FDA approved and prescribed by doctors, certain medications can still pose serious risks to your heart health. In today's video, we'll uncover 6 common medications that can lead to heart attacks, including those you might be using for diabetes, pain relief, and even common colds. From over-the-counter pills to widely used prescriptions, you'll learn how these drugs could be silently undermining your heart health, often without any visible symptoms. 1. NSAIDs, non-steroidal anti-inflammatory drugs. Non-steroidal anti-inflammatory drugs, or NSAIDs, such as ibuprofen, aspirin, and naproxen, are widely used for pain relief and inflammation control. Because they're available over the counter, it's easy to assume they are completely safe. However, NSAIDs work by inhibiting enzymes called COX-1 and COX-2, which can lead to significant side effects. Blocking COX-1 can cause gastrointestinal issues due to reduced stomach lining protection, while inhibiting COX-2 is linked to increased cardiovascular risks. This inhibition can increase the risk of blood clots, hypertension, and heart attacks. Studies, including one from The Lancet, have shown that certain NSAIDs can raise the risk of major cardiovascular events by about a third compared to placebos. Drugs like ibuprofen and diclofenac are associated with the highest risk, while naproxen is deemed somewhat safer for heart attack risks but more likely to cause gastrointestinal side effects. It's crucial to use these drugs only when necessary and at the minimum effective dose. People with existing heart or liver conditions or those taking other medications should be especially cautious. NSAIDs can interact with many medications, including antihypertensives, anticoagulants, beta blockers, digoxin, and even aspirin. Therefore, it's essential to consult with your doctor before taking these medications. 2. Erectile dysfunction medications. Medications for erectile dysfunction, known as PDE5 inhibitors, such as Viagra, Levitra, and Cialis, are commonly used to promote vasodilation, allowing more blood to flow through arteries. However, for people with heart disease or hypertension, this can strain the heart. These drugs also interact dangerously with nitrates prescribed for heart conditions, leading to significant drops in blood pressure and potentially triggering heart attacks. Erectile dysfunction is often an early warning sign for heart disease, as conditions like atherosclerosis can block blood flow not only to the heart but also to other parts of the body. While PDE5 inhibitors work wonders for sexual function, they can negatively impact the cardiovascular system by causing a drop in blood pressure that the heart might not be able to handle. 3. Diabetes medications. There are 3 common diabetes medications that can increase the risk of heart attacks: metformin, thiazolidinediones, and DPP-4 inhibitors. Metformin. While effective in lowering blood sugar levels, metformin can cause lactic acidosis, a condition where lactic acid builds up faster than the body can remove it. This can lead to muscle pain, trouble breathing, and even cardiac arrest, particularly in those with kidney problems. An estimated 30 to 50% of type 2 diabetics have kidney disease, often without knowing it. Thiazolidinediones. These medications increase the body's sensitivity to insulin by making muscle, fat, and liver cells more responsive. However, they can cause fluid retention, increasing the blood volume the heart needs to handle. This additional workload can worsen symptoms like shortness of breath, swelling in the legs, and fatigue, as well as increasing the risk for heart attacks. DPP-4 inhibitors. Medications like sitagliptin, saxagliptin, and linagliptin increase insulin secretion. Studies have found an increased heart failure risk with DPP-4 inhibitors. Researchers from the University of South Australia found a 15% increase in heart failure risk among users of these medications. If you're taking any of these medications and are concerned, talk to your doctor about potentially switching. There may be better alternatives, but equally there could be valid reasons why you're currently prescribed metformin, thiazolidinediones, or DPP-4 inhibitors. 4. Decongestant nasal sprays. Decongestants like pseudoephedrine, commonly found in nasal sprays, can increase systolic blood pressure, exacerbating underlying heart conditions and potentially triggering cardiac events. They interact with many medications and health conditions, increasing the risk of arrhythmias, hypertension, palpitations, and tachycardia. Additionally, overuse of decongestant nasal sprays can lead to rebound congestion, where symptoms worsen once the decongestant wears off. This makes them less effective over time. It is crucial to be cautious with decongestants, especially if you have heart disease, high blood pressure, thyroid disease, diabetes, or any other health condition. Always consult with your doctor before using these medications. 5. Tricyclic antidepressants, TCAs. Tricyclic antidepressants, used primarily to treat depression, can increase the risk for heart attacks due to their impact on cardiac electrical activity. TCAs block the reuptake of neurotransmitters like norepinephrine and serotonin, which not only alleviate mood symptoms but also affect cardiac ion channels. This action can lead to disturbances in heart rhythm, such as tachycardia, where the heart beats faster than normal. Tachycardia strains the heart, increasing demand for oxygen while reducing the time your heart has to fill with blood, ultimately heightening the risk of heart complications. Research has shown that the use of TCAs can also lead to cardiomyopathy, a condition where the heart muscle becomes enlarged, thick, or rigid, increasing the risk for heart failure. In comparison, selective serotonin reuptake inhibitors, SSRIs, a newer class of antidepressants, are generally considered safer. SSRIs selectively inhibit the reuptake of serotonin without significantly affecting other neurotransmitters or ion channels, which minimizes their cardiovascular effects. However, both TCAs and SSRIs can interact with other medications, particularly those that also influence serotonin levels like anti-nausea medications, triptans, mood stabilizers, and opioids. St. John's wort, a popular herbal supplement, can also interfere with these drugs, increasing heart attack risk. Always consult with a healthcare provider before starting any new treatment, including herbal supplements. 6. Diltiazem. Diltiazem, a calcium channel blocker used to treat high blood pressure and angina, chest pain, works by relaxing blood vessels and slowing the heart rate, improving blood flow and lowering blood pressure. A significant concern with diltiazem is its negative inotropic effect, meaning it can weaken heart contractions. This can lead to an abnormally slow heart rate, especially in those with pre-existing heart conditions. Diltiazem has also been associated with rare instances of liver injury, which, although less common, is extremely serious. Diltiazem is not typically a first-line option for managing high blood pressure, so if your doctor has prescribed it before trying other options, consider having another conversation with them or seeking a second opinion. Aiming to avoid or reduce medication dependence is always the best way to go, as all medications come with side effects. Conclusion: no medication is completely free from risk, especially at higher doses or with long-term use. It's crucial to use these drugs only when necessary and at the minimum effective dose. Always talk to your doctor about any concerns and stay informed about what you're putting into your body. For more tips on maintaining heart health and reducing medication dependence, check out our video on 10 amazing foods that unclog arteries. Stay safe and stay informed. For Osaya. 4-0.